Hey, welcome back everybody to another chiropractic reaction video. In the last reaction video we did one with Dr. Ian, who played such a pivotal role in my decision to even become a chiropractor, completely transform my life as well as so many other people. And now in this week, we got another very special video as we're gonna be diving deep into Dr. Rahim, who has also played a very important role in my development as a chiropractor, and he's really helped inspire me to, in the Gonstead work, to ultimately want to become a Gonstead chiropractor. And so I consider Dr. Rahim a mentor of mine. It's been amazing and incredible just listening and learning from him. And I can say, as an amazing of a doctor as Dr. Rahim is, he's an even better person. It's been absolutely great to learn from him. I'm inspired by him continuously, and I am honored to consider him a fellow colleague of mine in this work. So, nonetheless, sit on back, relax, and I'm gonna put my headphones on and we'll get started with this video. The video is titled Ballet Teacher with Sciatica and Hip Pains for 2 months, helped with Dr. Rahim Gonstead Chiropractor. Let's go. Dr. Rahim Gonstead Wellness. I love how it says go well at the end. So cool.
So the major injury was 2011, and that was where you rolled the ankle.
Yeah. So I couldn't point my foot.
But now you can.
I can.
Okay.
Yes.
What we did is, and from this injury, as we talked about, it's all kinetic chain. And the first thing that I mentioned, if you sprained your ankle, it's connected to the hip and the pelvis.
My right knee was bothering me a little.
For how long?
It comes in and out until now.
Still today.
Mm-hmm.
Okay, so we need to assess that as well. Upon assessment, she has an AS talus with a medial tilt.
But what initiated this in particular hip pain was an audition I attended almost 2 months ago.
Okay, I want to pause it right there. And so, what have we learned so far? We got a ballet teacher who's coming in. The primary complaint is sciatica and hip pain. However, upon the further history, Dr. Rahim found that she had an ankle injury back in 2011 where she had rolled and sprained her ankle. She also explained, if you guys heard that she was also having some knee trouble, and I'll explain why that is in the first place and how this is all going to relate back to her main symptoms she has. I want to get back first here to Dr. Rahim's communication skills. Absolutely, again, just like Dr. Ian, Dr. Rahim has an incredible patient communication and really just great table talk and table manner. So if we look here, whenever he's talking with his patients during the interview or history, he is meeting them at eye level. You guys notice that he's always sitting down and meeting the patient at eye level, and he's making eye contact with the patient as he's talking and listening to them. And that's so important because as a patient, it does two things. It shows that the doctor is actually listening to them, and how many doctors actually do that nowadays. And also it shows that they care about what you're saying, that what you're saying has value, and that it gives them confidence you're going to take care of them. And so meeting them at where they're at, both literally with the eye level and also non-verbally, is so crucial in the patient interaction. Starting off to a good foot there. And the next thing, as we said, Dr. Rahim mentioned the ankle injury. He mentioned that he found that she has an AS talus medial tilt. What does that mean? So the talus bone, a little anatomy for you guys, is it is the main articulation between the foot and the ankle joint. And so with the ankle joint, it is the talus and the tibia that come together to form that ankle joint. It is a mobile joint. So the AS talus, the AS means that talus has gone anterior superior, so essentially rocked up on the medial side. So it's tilted upward on that medial or inward side of the talus. It's very common with ankle sprains and ankle injuries like she had, and that's going to affect the overall mobility of the ankle joint, especially if you don't get that aligned properly. It'll start to calcify or start to get scar tissue within there that'll cause more long-term changes down the road. Now he mentions the kinetic chain as well, and I want to explain kind of what that means a little bit. And so with joints, there's two main classifications of joints in the human body. You have mobile joints and you have stable joints. And the way that it sequences is it kind of goes in a rhythmic pattern. So for example, the ankle, like we said, is a mobile joint. The knee is a stable joint. If we work our way up to the hip, is mobile. And then if we go to the pelvis, lumbar spine, and the core, is stable. So it follows this pattern of mobile, stable throughout the kinetic chain. And same is true if we get into the upper body. And so what's true is if one of the two is off, if the mobility or stability is off in any one of the two joints, that's its main function, the other joint is going to be affected. So for example, with this ankle injury. That affects her ankle mobility, okay? That therefore is gonna make the knee less stable. So you're gonna have a knee stability problem, which correlates with why she said she was having some knee trouble as well. Now, because the knee is unstable, that's now going to affect the hip, causing hip immobility. And that hip immobility is now going to translate into the core, pelvis, and lumbar spine. And now what do we have? Sciatica. That's primarily what? A problem with the foundation of the spine. Pretty cool. The human body amazes me. So let's get back to, where were we? 1 minute. Let's get back here.
Attended almost 2 months ago.
2 months
I
ago.
go down into plie,
Yep.
and
To
fast
plie?
I had to jump up
How high?
as high as I can.
How high do you jump?
High when I
2,
don't
3
have.
feet? 4 feet?
Probably
6?
6.
No, 6 feet?
Um,
That's taller than me.
And I had to keep my legs, pull them up even higher in a jump,
Ballet's so
Okay.
amazing.
and then land into plie again. And it was
Plie.
repetitive.
How many
repetitive.
times? 10, 20?
20, about 20 times.
20 times. When did you feel it?
I didn't feel it right away. I
Okay.
felt it when I came back home, and I felt it right.
There in the sacrum.
In the sacrum. Okay, so I want to point this, with the kinetic chain 2, it's almost exacerbated, or it shows itself more in people who are really athletic or extremely active. And this ballet teacher, I mean, oh my gosh, she's jumping 6 feet in the air multiple times all the time. That's putting so much stress on her joints. And so because of that, like we said, if she has a kinetic chain dysfunction, that's going to show itself up so much more, and injury is going to be a result of this. I see this in athletes all the time, where most athletes, they do what? They get ankle sprains, or they tear their ACL, they have a herniated disc. A lot of the times, the actual issue was caused by an underlying dysfunction. And this is true from my own experience, but if I tore my ACL, I'm not gonna get into all of it, but I had so many other underlying dysfunctions that took me years to figure that stuff out and to correct it. And same is true with athletes who get all sorts of injuries. Oftentimes, it wasn't the injury that was the actual problem. It's a sign that there's something underlying going on.
This pain transferred into my hips, but in like about 2 weeks after.
She's telling us that she has a rotated sacrum on the right, and she's actually showing us that. And we're going to go through that whole
Yeah.
exam and
The sacrum.
differentiate between sacrum.
It's also
and
interesting how
pelvis.
attuned
But in terms of
athletes are with their bodies.
Function.
You know, she kind of pointed where the issue was.
I need to be able to move freely through my hips.
Open and
Hip
close.
Open and close,
mobility.
bend and extend legs.
Okay.
And also lift in bend position and be able to hold the leg.
As you're
That's
going
tough.
through the movement, tell me where you're feeling the pain, okay?
In more open second position, as we call, when I go down, we have to, before we go down, we have to tug our tailbone under,
So when you say tailbone, you mean sacrum,
sacrum.
okay?
Roll it in, and we squeeze glutes, and we go down.
Okay.
And this is where
Ballet
I
man.
get the
You're feeling it here. So
Mhm.
she is pointing to the deep in the piriformis
Okay,
muscle.
this
and
is
the
important.
Gluteus maximus on the outside.
Okay.
Okay? Forward. No issue.
no issue.
Okay? Next.
Side,
You
I
still.
already feel it.
Now, go ahead and
external
externally
rotation.
rotate.
Yep.
I feel it.
Okay, yeah. So,
Okay.
so what we're seeing here, external rotation, that's primarily the piriformis, its main role. It does a little bit of hip extension. It's a weak hip extender, but it's mostly involved with external rotation. Typically the piriformis, it also gets aggravated in individuals who have weak hip extenders, which are more glute max, glute medius. If you have a weak glute muscles, typically the piriformis will get really irritated and inflamed because it's having to do a motion that's not used to be doing. A lot of information, but anyway, it's showing that her piriformis is very irritated and hot and active. It's pissed off. You got a pissed off piriformis. A pissed piriformis. Anyway, so the point of this is, in the medical community, they would probably, because she's having symptoms of sciatica, they would classify this as piriformis syndrome. So the sciatic nerve, it exits out of the lower lumbars as well as the sacrum. Those nerves come together to form this big little nerve called the sciatic nerve. That nerve exits out through the posterior portion down the buttock, and it tucks underneath the piriformis muscle. So the piriformis muscle is here, the nerve slips right underneath it like this. So the piriformis muscle is very irritated for whatever reason. It can actually irritate the sciatic nerve and create symptoms of sciatica.
And lift
then
up.
I lift, and that's the point where pain increases.
Same spot.
Mm-hmm.
Okay.
And then when I bend and bring it in, again. When I need to stretch my back leg in this position.
So that's stretching the hip flexor.
It's right here as well.
Okay.
Very deep.
She also may, and this is another thing too, a little side clinical note here. If she has like super tight hip flexors, we're already looking, she may have a weak core. She may have weak glutes because her piriformis is very tight and overly active. She has tight hip flexors. This is all a sign of something called lower cross syndrome. I'm not gonna get way in depth because that could be, I can get on a rabbit hole with that with lower cross syndrome. She seems like she's having lower cross syndrome, which means she has weak glutes, tight and active piriformis, tight hip flexors, weak core, and tight hamstrings and all that, which is all obviously can cause sciatica, hip pains, and things of that nature. So, just side note.
There.
All right. That's the
Insertion of the piriformis.
Insertion of the piriformis on the femur.
Right.
Mm-hmm.
Okay.
It's a pissed off period.
Right side.
So
All
we're
right,
getting.
so if she goes to, in the medical world, how they would treat piriformis syndrome, typically they'll do a host of modalities for conservative treatment. Things like various exercises or stretches, non-specific exercises and stretches, I should say. The different various soft tissue work, E-stim, cold laser, heater ice, all to mitigate the symptoms of the problem, okay? All to manage pain. Let's see what Dr. Rahim Gonstead Chiropractor does with this patient.
Big reading up top
Starting with the
left
scope.
in the atlas here. If the messages aren't coming down from the brain, how is it supposed to be working down here?
Mm-hmm.
Make sense?
How is it?
C1, C2, C7 on the right.
C1,
Now watch the
C7.
needle stays all the way right, all the way down to there.
Sacrum.
And first thing we're
All
going to
right,
do is
so for those of you who aren't familiar with the nervoscope, it's measuring for temperature differentials. Essentially, inflammation, a byproduct of that is heat, and so this is measuring very specific changes in heat, representing inflammation in and around the area of the spine with a specific segment involved. Here we found some nerve pressure up there in the atlas of C1, lower cervical around C6, C7, and then the sacrum. So now he's going to go in, and now he's going to begin doing some static palpation, feeling for inflammation, tight musculature, pain. that sort of
static
thing.
palpation down the spine. A little bit of redness in through there, but that spine looks pretty darn good. That's where the edema starts.
You guys see the tissue change? It's very subtle.
Where the mold
You can't really see it that well. It's more of a feel.
Right there. You feel that?
Mm-hmm.
Yep. Now the thing is, this is a compensation. This isn't the actual, we're not getting a reading here.
Mm-hmm.
But because of this is compensation.
Really big point that he just made there, compensation. So does it make sense, can you guys visualize that if the sacrum is off, if the foundation of the spine is off, that's going to create different compensation effects in different parts of the spine. So for example, typically she was finding around the upper lumbar area, that's a common area for compensation. That will typically show some inflammation, a lot of pain, a lot of tenderness there. But it's not the cause of the problem is underneath it. And typically the compensation will not show all of the different signs and variables that we study in the Gonstead work with our criteria. Like Dr. Rahim showed, it didn't show a break, although it's tender, although there's a little inflammation there, it's more than likely it actually is a compensation for her. And we don't adjust those.
Okay.
We don't adjust compensations.
What we're doing is general motion SI joint. Open wide, close. A little faster, please. Okay, left side only. We're saying right, but this left feels more stuck.
Okay, so I want to explain this just because I know Dr. Rahim does this in all of his videos as part of the pelvic analysis. Typically what he's measuring for is whenever you're opening and closing the knees like that, the pelvis should open and close just like this. You'll feel it open and close like that. Okay, so he's doing both sides. It has general motion for both bilaterally, and then he has the patient do one side. Now whenever you do the one side should move, open and close, and the other side should stay put, because they're independent of, they're two different joints, so they should be working independent of one another. If one is stuck and there's fixation and there's a problem there in one of the joints, whenever they do the one side, the other side will want to go with it. That's representing an SI joint problem on that side that's wanting to travel to the other side. If there's a sacrum involvement, as we may suspect in this case, typically it'll show mixed signs. So it'll kind of shift to both sides, indicating more of a sacrum issue.
Please. Okay, left side only. We're saying right, but this left feels more stuck.
And that's
Okay,
the mixed
what we're
issue.
doing
It's the
now
right
is
side stuck, but
individual
yet the left
motion, top
side
of
is
the
showing
joint.
it stuck.
Let me
Mixed
do the
variables
work.
there.
Middle of the joint, bottom of, yeah, right.
There it is.
We need to adjust the sacrum of the pelvis. We're gonna do a
No.
leg check. You can see this side is a little bit shorter than the left.
A leg check.
When we bend
A
the
leg
knees
check.
90 degrees, if this stays short, we're gonna adjust the
All right,
sacrum.
I gotta pause right here. The leg check. Wow. So typically, leg checks are used in a variety of different techniques, often to show variability, whether what to adjust or when to adjust. In the Gonstead work, we don't necessarily do leg checks. Reason being is because there can be some reliability factors that could give us false readings for what we're actually looking for in this work. There's an exception to the rule, however, the Gonstead leg check, which I reacted that way because it's actually a pretty rare. You don't normally see this done a lot, but it's to differentiate whether you have an ilium problem or a sacrum problem on that same side. So like he's explaining here, if the ilium, whenever you raise the legs up in knee flexion, if it gets longer, it's an ilium problem. If it stays short on that side, it's more of a sacrum issue. Gonstead leg check.
If
That's so
this
funny.
goes longer than the left leg, we're gonna adjust your pelvis, okay?
Oh no.
Let me do the work. Stop helping. Stay short. So what are we doing?
Sacrum.
Sacrum. And that's what we said, right?
Yep.
Cool. This is called divorce test. We're going to turn left. We're going to turn right. That don't feel so hot there, does it? Now,
Her faces.
let's isolate the lower.
Her facial expressions.
cervical. Turn left.
They cracked me up.
That's not so bad. Turn right. Okay, so we're going to do left atlas. We're going to do right sacrum.
Okay, so how we came up with the atlas, remember during the scope we found some pressure there up in the upper cervical as well as the lower cervical. He's typically not going to do both of those at least on the same in the first visit, and so he did a divorce test, which is essentially isolating different parts of the spine and putting rotation to see which one is more aggravated with the biomechanics. And so whenever you put the head down in flexion with rotation, you're isolating the upper cervical, the atlas, and whenever you put the head in extension, you're isolating the lower cervicals and putting rotation there. In her case, it was more restricted and more painful with the next flex, so that's why he's going with the atlas, and then obviously he's going to go for the sacrum.
Ready? You ready?
And she's nervous, she's like, okay.
Seatbelt.
Ah, he's strapping her in.
And down.
Yeah, she's
Get
freaking
the
out. She's
seatbelt
like,
to
what
hold
is
this,
happening?
okay? Gonna make that
What in the
adjustment.
world is going on?
Nice and easy. Happy place. There we go. Happy.
Your life's about to change, that's what's going to happen.
Hold on. Beautiful. Walk it off. You okay?
Yes.
Walk it off.
She's like, oh my
Oh,
gosh.
like gave me so much movement.
Okay, so if you guys have never gotten a Gonstead adjustment, particularly a cervical chair adjustment before, which is what Dr. Rahim had just done, was a Gonstead cervical chair move on the atlas, it is life-changing. It is absolutely incredible adjustment to receive. Your whole body just like feels so light in the head, especially with the atlas adjustment. Is extremely powerful, probably the most powerful adjustment you can get.
Do your movement again. I didn't touch your back yet, okay? And just from what I did, that should already feel different.
It does.
Tell me.
It does feel different. Everything feels different.
Walk it off. That's a powerful adjustment.
Mm-hmm.
That is the atlas.
The
You go
atlas
through your movements.
carries the world.
Go through some fluid movements. Just be you, okay?
It's
Be you.
already.
Just be you. Just go through it. and
Look
be
at her.
you.
You can tell she's like feels different, you know.
Look at her face when she's doing it. She's surprised. I love it.
She's like,
I'm just
what
trying
just
to figure
happened?
out how
You
is
just
that
touched my
possible?
neck. Why do my hips feel different?
How is what possible?
That
It's all
connection.
connected, isn't it?
It's all connected. The body's all connected. It's one system.
Fire the glutes.
Mm.
Fire them. Squeeze it.
Like the
Squeeze it!
pain is
Squeeze the
gone.
glutes!
It's just a little soreness.
Rotate out. Raise the leg to the side.
Huh.
No.
Bend. Hold on.
She couldn't
go
do that
back.
before.
This is cool.
before, remember she did that? It like stung really bad.
We did an ASL atlas on the left side, and how that affected Olga, it's not magic, okay? It's this.
It's
If
really
there's
magic.
tension,
No.
look, this is the foramen magnum, this is the brainstem, this is where the messages go down. If there's tension in the spinal, in the upper cervical, it can cause rotational tension, a torsion of the cord all the way down.
Right, this is huge, guys. This is so huge, especially with the atlas. This is why some specialties in chiropractic only focus on the atlas bone. It's called upper cervical chiropractic, and it's incredible. And that's why you see there's so much research and case studies being done where these patients, they get resolved with sciatica and all sorts of other issues just from adjusting the atlas bone. And so Dr. Rahim kind of gave a short explanation with why that is. It creates rotational torsion of the actual spinal cord itself, and how it does that is you have these ligaments that attach to the spinal cord. So whenever there's rotation of a vertebrae, mostly in the atlas, it's going to rotate and tighten and bring tension in those ligaments. They're called dentate ligaments that hold the spinal cord together. And because of that, it creates a universal tension throughout the entire spinal cord, and that tension is going to build up in one particular area of the spine. Now, the sciatic nerve is formed at the tail end of the spinal cord, so all that tension can actually bring up and actually manifest in the sciatica symptoms. The body's amazing. Why? Because it's all connected, and we got to find the root cause of the problem.
She's clear. Mid back is clear. I think I'm going to leave it for that.
Did you see
today,
that the
okay?
sacrum was clear
And
too
then I'm
when you
gonna
ran it? Did you see that?
check you in a couple of days. Still off a little, but different. AS talus.
Mm-hmm.
That's it. Posterior.
Now he's working on that ankle.
Oh my God.
Oh my God, what?
And that's changing everything now.
Tell
Because now
me.
we're working on that kinetic chain
Point
component.
a little
You
bit.
can point better now.
I can
She can point better. Amazing. Now look, in this issue too, I understand there's definitely a lot of like, how in the heck can that happen? Her sciatica completely went away from adjusting the atlas. Now look, we talked about, I don't even know if he's gonna do, we're at the end of the video, I don't even think he's gonna do the sacrum adjustment. Let me see.
Gone.
What's that?
The pain is gone.
Tell me.
It's almost gone.
Amazing.
It's like a little soreness in my muscles, but that
And
profound.
you've had this for how long?
Almost 2 months.
Wow, and that's it, yeah, wow. Gonstead Wellness, amazing. And so, look guys, that was a powerful, powerful, powerful video. The lessons that we can take away from it. Again, like I was saying, look, there are definitely two components with it. Okay, Dr. Rahim found the pressure of the atlas that was creating that spinal cord tension. You adjust that, that obviously made a significant difference. But we also can't rule out the fact of the kinetic chain, the ankle injury that's then throwing off the hip, which is affecting the foundation. I think those two components alone was what was creating the problem, not actually the problem itself. And so what's the lesson here? You know, again, if we go to most healthcare professionals, most doctors, and again, it's not their fault, but what are we just trained to do? We're trained to treat the symptoms. When the patient comes in with pain, they say, "Doc, my low back is hurting me." What do most doctors and chiropractors included do? We want to look at the area where the pain is. Obviously, it makes sense. But there's more to the equation. Oftentimes, where the pain's coming from might not always, and in fact, most of the time, isn't the actual cause of the problem. I always believe that the doctors, chiropractors especially, are investigators. We are spinal or really whole body investigators to find out what's actually causing this whole thing. We found out the kinetic chain influence, but then what do? We found the atlas. Dr. Gonstead had an amazing, he always repeated this to his students. He always said, find the subluxation, accept the subluxation where you find it, adjust it, and leave it alone. And so in this case, Dr. Rahim did an incredible job by following those wise words of Dr. G, by finding where the subluxation was, which was up in the atlas, adjusting it, and letting the body heal and do the rest and leave it alone. There was no need to even bother to work with the sacrum because you already saw such positive changes. Not to say maybe later down the road, may you have to work on it? You very well may, depending on what shows up whenever they come back a few days or a couple weeks later. But absolutely amazing, and that just shows right there the body's incredible ability to heal itself once the interference or the problem is removed. So I hope you guys enjoyed that video. I hope you got something out of it. If you did, give it a like, and if you want to see more of these reaction videos, comment below what videos you want me to react to, what chiropractors do you want me to do a deep dive with, and give the extra information to you guys about. And if you're not subscribed to this channel, you better do that and give me a subscribe. I hope you guys enjoy this one again, and I'll see you all soon.